Great.
Yeah.
Okay, great. Thank you all. Thank you so much for having me, and thank you, Shruti and Dr. Watson, for your presentations. Um, I'm going to share my screen. Are you all able to see the presentation?
Yes.
Excellent. Okay, so I'm going to share my advocacy journey and migraine, my journey living with migraine disease, and tie it into how I navigate that in the workplace. So, okay. So, in the bio, you heard a little bit about me. I work full time, and up until uh, this summer of this past year, 2020, I was also in school full time. Um, which is very challenging, but at least I can take one of those things off. At least no more school full time. I'm glad to be finished. One of the things I love to do is travel. I love traveling. I love seeing new places. The area I live in, I don't have much family close to me, so usually I travel. I'll just hop in a car and just go for a weekend to see some family members in different states. Um, so if you are seeing me on social media, the few times I do get on there, I might post a picture of me traveling someplace, mainly because I've tried to find a way to live with my disease, but still try to do some of the things that I enjoy, even if I have to do them in a different way. I love to eat. I cook. I love to eat. I love to try new food. I'm very extroverted. Most people that meet me um, um, after my living with chronic migraine disease think I'm introverted, but that's because I'm just calm, but I'm very extroverted. I love people. I love talking to people. I love spending time with people and getting to know people and their stories. And another thing that I do enjoy is community service. I love connecting with the people in my community, whether it's providing food to people who may not be able to get food for themselves given their condition, or just volunteering for different things. I volunteered and did a deployment for COVID-19 just to support. So different things like that. I still try to find a way to be involved with my community, even if it's not primarily focused on migraine or headache disease. And as Katie mentioned, I am a support group leader, and I love it. I think that's probably one of my favorite things because in our group, no matter how awful I'm feeling, like I have to be to the point where I can hardly move to not join the call. Like you may see people, at least on my group, people will be on and have green lights on, or people are just laying there under covers, or some people don't even turn the camera on. But no matter how bad we're feeling, it's like we feel so good in that meeting because it's amazing to be with people that understand and know what you're going, know can relate, even if our diagnoses are different or the type of migraine and headache disorder that we have might vary. It's the only place that I found that I truly can just say anything and people will get it. So it's really an amazing support system. And as you've heard almost everyone say, just find a group. Support is very important. We're not here to be on our own. Community is important. So I do want to just tell you a little bit about my story. I've lived with chronic conditions my whole life. I have had migraine since I was a child. However, I was always told that I'm just having a headache. I can vividly remember one time that my um, dad carried me from my bed to the car to the hospital because I was in that much pain. As a young person, this was the only thing that really took me to the emergency room, besides the knee dislocation, which was pretty easy to determine what was happening. But I pretty much, that was the only reason. And it was always, I just needed to take some Motrin or something like that. And that followed me up into adulthood through college. So I've always had to sleep with water and Motrin by my bed. So I didn't get a diagnosis until 2015, and I was very shocked to find out that what I was experiencing was migraine disease. It took a long time for me to be convinced, because like some people who've never experienced it or don't know, I just thought a headache could not cause the kind of symptoms and debilitating condition that I was experiencing. So I had to learn a lot about my condition when I was diagnosed. Before then, um, I had a car accident, and that left me with a herniated, protruding, and torn disc in my back, um, which, which some places that will only take like maybe a minute or so to walk, maybe just to my kitchen, right? It would take me about 30, 40 minutes just to walk to the kitchen. That's how much pain I was in. And then prior to that, I had chronic dislocation of my right knee. My kneecap would literally just, not my right knee, my kneecap would completely dislocate laterally. And that will leave me on crutches. And for about a year and a half, I was in a wheelchair. So that I've had people, friends in high school or college who had, they would saw me recently and had never seen me walk before. So it's just, this is a journey, like knowing chronic pain or just pain in general is not new. This is something that I've lived with in different capacities, but um, it's helped me to really deepen my purpose and understanding that sharing my story, sharing what I've been through is very encouraging, not for others, but even for me, because when I look back and look at some of these pictures and see, it's amazing to see that, I can run now, but I was in a wheelchair, so this is really my story. This is where I've come from. I don't have other comorbidities, but it just seems like if you look at the years here, it just seems like, okay, I had the surgery, I'm good. But then now my back, oh wait, okay, right before I think the month that I was getting the procedure for this disc is when my chronic migraine started. So it just seems like it feels like sometimes it's a never ending story, which I think some of us may experience dealing with migraine disease. It's like maybe a medication will work for a while and then it doesn't. Or, you feel okay for a while and then it doesn't. It seems like it's always something going on. But in reality, what I've learned is that through each one of these stages, I my visions changed, my dreams changed, and I have become a person that realizes that it's okay that this is my story because it's my story. And I can make this appear or the outcome however I want it to be because it's my story. So that led me to really, as Katie shared in my bio, that I learned that it's important for me to advocate, to share my story in order to create change. More visibility in chronic pain and migraine specifically helps reduce the stigma. And the more people see us, the less they can ignore us. And I've learned that sharing my story allows people to see that this is a real condition, that it's not something I could just pop a pill for and just move on. But that may happen sometimes, but not all the time. And so I think my circle has become a lot more understanding because of me being more willing to share my story. And I'll just say that going back to this, when I see this slide here, it makes me sad, right? Sometimes when I look at it, but I've had to change my view of myself because if I look at myself as someone, I always have pain, I it hurts even more if someone else says it. But if I look at myself and say, wow, look at what I've survived through, that's so much more encouraging than thinking about how difficult this journey has been for me. So that's why I'm very encouraged to advocate for myself and share what it's like living with my conditions. And the more people, again, the last bullet, the more people see us, not just our outward appearance, but see what we live through, what we go through, who we are as people with invisible conditions, it's harder for them to ignore it. So I want to talk about disability in the workplace, and this is just This was a study done in 2020 by the national, at least the data were published in 2020 by the National Organization on Disability, and they said that only 13% of the companies in the United States have reached the Department of Labor's target of having at least 7% disability representation in their workplace. And this is why advocating is so important, because no one should have to decide between their health and their career. And unfortunately, we do. And that's difficult. No one should have to do that. There was a Forbes article on how to thrive, or entitled How to Thrive When Chronic Illness Disrupts Your Career. And one of the contributors to the article, Ella, she said, I'm left with two choices. I can either risk my life or forfeit my paycheck. Honestly, that hurts. It's painful that we have to make that decision. And so we have to keep pushing, we have to keep fighting, we have to find our voices. And however we do that, there's no one set cookie cutter way that anyone should feel they have to share their story or advocate. But however we do it, we must keep advocating, because no one should have to decide between their health and their career. So I want to talk a little bit about how I've dealt with migraine disease. This is very personal to me. And I do want to start off by saying I recognize that the position I'm in, I work in the government. So we do have, certain guidelines or laws that protect us. So it has been, my story is a little different. It may not be applicable to all because of the type of position I have, but I did just want to share what has helped me, and hopefully this will be encouraging to some of you who may be facing, as we had the questions on how to share, what we're experiencing. So I found that I was diagnosed actually in 2015. I was working with a number of doctors and I've been blessed to have people who have been supportive of me. But once I started understanding my condition, I realized one of the best ways for me to address migraine at work is to try my best to prevent an attack. Of course, there's so many things that are out of our control. Our bodies sometimes do what they do, but there are certain triggers that I know I have, and if I can minimize those triggers in the workplace, that has been very helpful. And so in the next slide, I'll show you some of the ways that I've been able to address that. The second thing is, again, if I am exposed to a trigger, minimize the impact of those triggers while I'm at work. So for example, later on, I'll also share this, but one of my triggers is fragrances, and people love wearing fragrances. So if I am triggered, I try to find ways that I could, help myself in that regard. I don't have many medications that are not sedative. Yes, are like a sedative that don't put me out. So if there's something I can take while I'm there, I try to keep an emergency kit at work with the medications that I'm able to take. Also, before COVID, I wore a mask. I feel so much more comfortable now. It felt very uncomfortable, but again, I have to do the best that I can to protect myself and help myself in the workplace. So that was something that I did. And I keep my office door closed. I have shared with my coworkers that it's an open door policy, in that just because my door is closed doesn't mean I don't want to talk to anyone. But I've tried to explain that it's not to shut people out. It's just sometimes I can get triggered. So I will share with you some of the language that I used, just so people don't think that I'm closing them out because my door is closed. And then three, Shruti did also mention this in her presentation, but so I won't go into too much detail, but really just understanding, I took some time to understand the policies that we had in my office. What are the sick policies? What are the policies around managing absences. Again, one of the concerns, at least for me, is performance evaluations. I never want my absences or not measuring up to affect my performance. So that's a very difficult decision because like we said, we don't want to be seen as the person with a sickness, always sick, right? We don't want to be seen as the one who may not be able to handle a certain task or things like that. We want to feel like we're adequate, and we are. We're definitely capable. It's just that we're differently able. So the way that I may complete an assignment may be different from the way the other person does, but it doesn't mean I'm not capable. So being mindful of what these policies are, understanding we have an HR. So if needed, just making sure what are the policies around a reasonable accommodations and things like that, and how can I leverage that to be the best employee who happens to have a chronic condition. And then knowing when to talk, knowing when to share. Sometimes, we want to keep our personal life separate from our work life. But I remember very clearly I was at work and my supervisor at that time came to me and said, "You really don't look well." Like, we were in a meeting. And after the meeting, she just asked to talk to me and she said, "You just really don't look well." And that's when I decided to share. One, because I don't, with my type of migraine, I can, have paralysis, I lose my vision. There's so many things that happen that I felt it was important, at least for someone not to get too alarmed based on how I'm looking or what they may be seeing. So I did at that point share, but knowing when and when you feel comfortable and how much to share and the right words, as Dr. Watson also mentioned. Again, telling your employer can seem like a daunting thing to do, especially because there's so much misunderstanding and stigma surrounding our condition. But employees are less able to provide support and understand the condition if they don't know what we're experiencing. So it could mean that, you share why and how, what you specifically experience, and like they said, what you're able to do, things like that, but not presenting it in a way that you are not capable, because again, we are very capable. And then maybe you need to reach out to your doctors, provide written notifications and things like that. And then I put support systems. So we talked about support, we talked about our support groups, we talked about family and friends, but I found having a support system is very important in life, especially if you have a chronic illness. But I also found that getting support from your colleagues is another way of having a support system. Like, having a support system at work, to me, is important. And having those people as your ally and advocate is so helpful when you're dealing with a chronic condition. So I found that my support system at work has helped make managing my migraine condition a little bit easier. So I just wanted to share a few ways that I have made this a little bit easier for me. And this is I haven't used all of these, but I found this graphic and I was like, oh, this is perfect, because these are some of the things that I've done. So flexible working, I know it was hard, before COVID. We had to fight for flexible working hours or working from home, and then COVID, and oh wow, everybody can work from home. But for some reason, we couldn't do it before, but now everyone can. So just looking for flexible working conditions. And the other thing that's helped me was lighting. So I have, in my office, we have a dimmer. So I can dim the lights, or I can just turn them completely off if there's enough natural light from the windows outside of my office. Technology, like I did now, is changing the hue on my computer, but my work computer, I had it set up so that it's not, the what do you call it? The black light? No, blue lights. The computer is much easier for me to look at, especially if I'm looking at a screen all day. So just taking my breaks. Now, I haven't had to ask for flexible breaks. I've just made them flexible myself. I, I, take breaks as needed. I usually don't look at my computer for more than 30, 40 minutes at the most, and then I take a break. So they've been very accommodating for me when it comes to medical appointments. Sometimes if I need an appointment during work hours, I'll take leave, but a lot of times they're very flexible. I'll just start work earlier, or I try to make them in the afternoon, or if they're in the morning, I'll stay a little bit later. They've been very accommodating for me to be flexible with my work hours. Also, there's certain days I try to keep my appointments on certain days. Like I started a new position, and with that one, the entire team meeting was on a Wednesday, but my appointments were always on Wednesdays. So I try to switch my appointments so that I can at least attend the meeting, so I'm not looking like I'm not part of the team. So that was one thing that we were able to work out. To where I could just switch the appointments, or if that wasn't working, then I could come in for the team meeting, but then leave so I can go to my appointment. So they were very flexible with that. So these are just some ways that I have found that have been helpful for me as I've been navigating migraine disease in the workplace. So next, I just want to share a couple of stories that hit me, impacted me when I think about why it's so important to advocate for yourself when it comes to migraine disease in the workplace. So these are not my stories, but these are just a few people who you may, no, two people. One person I think everybody will know, but the other person maybe not so much. But I thought their stories were pretty interesting, so I wanted to share. So this is Matt, and I came across it because I watch, again, I told you guys I love to eat, I love to cook. So I watch cooking shows. So he was on an episode of one of the cooking shows, and I just want to share a little bit of what happened. And I almost stopped watching the show after this happened. I got so frustrated. By the way, I watched this recently, I think within the last month, but I'm like a late watcher to everything. So I think this probably happened they're in season 19 of the show. I think this was probably season 2, which I just watched like recently. So this is definitely something that's happened in the past, but when I watched it, it just really impacted me the last couple of weeks. So this guy is a chef in the kitchen on the show. And again, this is reality. So this really happened. It wasn't, so the head chef was calling the next ticket and asked for a time when the order would be up. So I'm saying he said they gave an excuse, and I say excuse because that's what they called it. They said, "Oh, you're giving us an excuse," but he said that he was working through a migraine attack. And then one of the other coworkers or staff in the kitchen called him a crybaby. So then they asked again, they said, "What's the time?" And he kept hesitating, getting an answer out. And then the head chef came over to him and said, "What is going on?" And because he couldn't even answer that properly. So he came back and said, "Look, I'm having this migraine." And then he took a medication and just popped it in his mouth and tried to keep working. Another coworker laughed at him. And then Matt said, "This is not funny." And so the head chef said to him again, he's like, "I've been having a migraine since we started." Of course, he's being sarcastic. He's just saying that, you guys you're irritating me. And so Matt said to him, "Look, I'm not feeling anything in my hands. I'm getting lightheaded," all of this stuff, which will happen if you're having a severe attack. And you could tell he was really, like, I could see it in his eyes. So the head chef said, "Just just get out of my kitchen and go lay down." And so basically he kicked him out of the kitchen. And it just really frustrated me. It's like, "Oh, you're crying over a headache." That's what they kept saying. And it's just like, this is his job, this is his career, and this is how he's treated because of the lack of understanding. He's called a crybaby. Someone said, making a joke, "Well, you've been giving me a headache since we started," and then got kicked out of the kitchen. So and when you think about this, sometimes, there are people who are kicked off their job, who are fired because they are dealing with migraine disease. So, this was a story that really impacted me because I really felt his pain. And I think he was kicked off right after that. And then the next one I wanted to share with you guys is Whoopi Goldberg, which I think most of you know. She's been dealing, she just recently did an article and I read it. And so she talked about how she has had to deal with powerful and painful migraine attacks for about 40 years. And she said it was like there was a monster that would show up in my house whenever it felt like it, and there was nothing you can do about it. Um, and she said that her having migraine disease has made her anxious about what the next day might hold, when the next one is going to strike, and how it's going to interrupt her day or her days. And I'm just quoting her saying that the impact has been fear, basically. You start to get one and wonder, is the whole day going to be shot? How do I explain to somebody that I'm in the middle of doing this one thing and I should probably stop? I just want to go in the bed. I just want to go in the closet. But you have to power through, which is something that we have to do, and we don't have a choice. And sometimes that's what it's like. You know, there's moments, even though I have great accommodations, understanding teams, sometimes I just power through because I just don't want to always I don't want to always say, I'm having a migraine attack. I need to stop. I need to rest. But it's like we have no choice. Sometimes we just have no choice. So I shared these two stories just because, you know, these are people that are not necessarily everyday people, but are everyday people, but just showing that migraine disease impacts our work in so many different ways. And that's why it's so important to advocate. And being your own advocate does not make you a difficult person. It doesn't make you a difficult patient. You should and you can voice your needs, your concerns, and your ideas. And that's what advocacy means to me, especially in the workplace. I'm not difficult. I just need some things need to be different for me to be successful. Migraine advocacy is more important than ever before. You know, people don't always understand the intense physical and mental toll that this condition can take. And unfortunately, if people haven't had a migraine attack themselves, they just don't understand it. And there's no real way that you can make them understand what it feels like. So they're all, you know, so sometimes they can be slightly condescending, like I shared in the previous story. The guy was called a crybaby. Sometimes they're like, oh, a migraine, oh, you know, they're not sympathetic, but this is why we have to keep sharing our stories. So just a couple more things. I wanted to share this. It's a lot on here, but I just wanted to share this because this was a policy that was enacted in my office in 2019. And I would say, like someone asked about, you know, talking to employers previously. I would say one of the things that is helpful, we recommended an anonymous way to respond to leadership about common concerns. And one of the things that kept coming up was the fact that there's people with conditions who are affected by fragrances and things like that in the workplace. And I have a few things underlined and highlighted here to where they actually responded. And my office has been around for 11 years now, but think about the entire government. Like the government's been around for decades. So when it was stated that, you know, there's no quick fix, this is basically people voicing their concerns over and over and over, and more people saying it and more people saying it. And 10 years later, here we are with the policy. Maybe some of the people that came before us didn't get to experience it, but it's important that we continue laying the foundation for more people, because as we make change, more change will happen, more change will happen. So I was very excited that my office sent this out because, you know, we have to think about all the individuals who continue to advocate, and we get to benefit from their hard work. And because of our hard work, there will be people after us who get to benefit. So we get to make impact on future generations. So I just encourage you, don't stress about the fact that sometimes changes are slow. It takes time, but just keep pushing forward. And then my last few slides, this is how I encourage myself. I love quotes and little sayings throughout the day. This is how I encourage myself. And so I just wanted to share a few things with you. I see you, warrior. Keep going. And just because you could yesterday doesn't mean you can today. But alternatively, just because you can't today doesn't mean you won't be able to tomorrow. Be gentle with yourself. You are doing the best you can, and you are stronger than you think. So I just wanted to encourage you with that. And outshine your label. So we talked about how sometimes we're seen as migraineurs or the person with the migraine disease, and someone actually couldn't remember my name. They were like, migraines, like trying to think of my name. I was so offended. But that's the thing, we want to be seen as people, not conditions. So really do your best to outshine your label, and remember that your present circumstances don't determine where you can go. They just determine where you start, and just know this is where you're starting from. And then lastly, just find your voice and inspire others to find theirs, because the more we speak out, the more we share, the more we'll see change. And just remember, your advocacy journey and how you advocate does not have to look like everyone else's. It's okay. And then lastly, I love this quote: each step was legendary, not for where she or he was heading, but because you were brave enough to just keep walking. And that makes every step you take legendary. So I just want to thank you all. And I appreciate the opportunity to share. And I hope that you all have been encouraged by my story.
Love it. Thank you so much. Does everyone see why she is my friend? Anikah, that was wonderful. And I thank you very much. I want to make sure there's no questions here in the chat. I don't see any questions. Does anyone have anything for Anikah? Anikah, I too am a quote person, so I love all your quotes. I have them everywhere. So I love them.
I have the one you sent me.
Oh, you do?
It's right, yeah, I have the big one. It's right there. It's like literally it's the first thing I see when I wake up in the morning.
Nice. Yes, I sent her one. I sent her a little one. Anyway, I want to thank everybody. We've reached the end.